Okay, so our next section is also emergency room situations, but these situations are moving or changing slowly enough that we shouldn't necessarily require an ambulance, and there is probably enough time to drive to the ER as opposed to calling 911. So our first scenario is similar to a call 911 scenario with a potential heart attack or a potential pulmonary embolism, similar kind of symptoms. Both are still medical emergencies, both need to go to the ER. The difference between calling 911 or driving is the stability and how fast it's progressing. If it's progressing fairly slowly over a couple of hours, then you've got time to go to the ER, but when you get there, you want to tell them you think you're having a heart attack. If someone has sudden onset of any of these symptoms and they're getting worse fast, then that's call 911. If you think you're having a heart attack, and there's no reason to not call an ambulance. Absolutely, certainly ambulance transport is always appropriate for that. But if it is moving fairly slowly, if it's been stable for hours or a day, it is okay to get in the car and drive calmly to the ER. So anyway, these symptoms, as we covered before, are symptoms of a classic heart attack. Pain may also radiate to the arm, neck, shoulder, jaw, back. You may have nausea, you may have sweating, you may have maybe a feeling of dread. The pulse may be irregular or weak. The blood pressure may be low. And again, just as a reminder, women can have some of these symptoms when they're having a heart attack and not ever have the chest pain. So it's an important thing to remember. So again, looking at an airway that we're starting to have trouble with, this is very similar again to the call 911 version, but it's moving slowly. So an asthma attack that's very gradually getting worse, or it's not resolving. A collapsed lung, heart arrhythmias, so somebody's got severe heart palpitations and they're going on and on, it's time to head over to the ER to get some medications to calm that down, and also to get an EKG to understand what the rhythm is. If someone has chest pain and shortness of breath, but it's not getting worse by the minute, that could be angina or heart ischemia, which can be a precursor to a heart attack, or it can be a condition that people have for years before they go on to have a heart attack. So it's not that a heart attack is necessarily imminent in the next few minutes. It can also be a collapsed lung. And these are both very serious. They need to go to the ER, but they don't necessarily need to be transported in an ambulance. If someone's blood pressure is near or over 180/110, if their pulse is over 100 and irregular, and they feel their heart fluttering in their chest, or their blood sugar is over 300, I can imagine a few scenarios where people are like, oh yeah, it's always like that. If it's always like that, they don't need to go to the emergency room, but they do need to go to urgent care or their doctor. But generally speaking, when your vitals hit these numbers, there's a medical emergency imminent. New onset of intense abdominal pain for 2 to 24 hours. This can be so many things. All ER doctors just go, oh no, here we go. It is the dreaded presentation in the ER because so many things refer to the abdomen. This is actually the short list of worst case scenarios. Could be appendicitis. That is often accompanied, but not always, accompanied by fever and vomiting. It could be a gallstone blocking a duct. If they've had a bowel movement, they'll notice that their stools have become pale, but they might not have had a bowel movement. They may have shoulder pain. An ectopic pregnancy or an ovarian cyst rupture. An ectopic pregnancy can rupture the fallopian tube before a woman is even aware that they're pregnant. Ovarian cyst rupture, intestinal torsion, and these are just some of the worst case scenarios. All of these are potentially fatal, and all of them need emergency medical care within hours, or they can be fatal. So those are worst case scenarios. Here's the deal though, those exact same symptoms could be gas. It could be digestive pain, it could be a gut flu, it could be food poisoning, it could be so many things that are absolutely benign. But because there are so many potential life-threatening things that can cause a sudden onset of intense abdominal pain, those things need to be ruled out quickly. Other GI symptoms that might need the emergency room: vomiting large amounts of red blood, like a half a cup or a cup of blood. Severe constant abdominal pain with no passage of gas or stool could be a bowel obstruction. Significant rectal bleeding, again, half a cup or a cup. Severe constant vomiting or diarrhea where they can't stop throwing up. Rapid onset of urinary or stool retention, or rapid onset of urinary or stool incontinence. This is a weird one. So either way, someone suddenly can't control their bowels or their urine, or they suddenly can't pass urine or can't pass stool. They know it's there, they need to pee, and they can't. If that comes on suddenly, that's a medical emergency called cauda equina syndrome, and it has to do with the severe pinching of one of the nerves that comes out of the sacrum. And this needs to be addressed actually right away because it can be life-threatening. If someone has sharp, low, one-sided abdominal pain in a female, that might be an ovarian cyst, or it might be a ruptured ovarian cyst. In either gender, it can be appendicitis. It can also be diverticulitis, and all of those need fairly rapid care. Sudden onset of testicular pain can be testicular torsion, which also needs rapid medical care, but it's not life-threatening. And then vaginal bleeding that's severe enough to cause fainting. And in this scenario, they may need a blood transfusion, which requires being in the emergency room or hospital. So revisiting our allergic reactions, this is very similar to the call 911. The difference is in the severity and how quickly it's progressing. So if it's progressing quickly, then that's call 911. If it is progressing slowly over an hour or so, then you want to make sure the person's taking Benadryl and you can drive them to the ER. Sudden eye pain or sudden onset of a severe headache that's getting worse, but it's not getting worse really, really fast, that is a drive to the ER situation. Coughing blood, burns. So this is interesting. So burns are actually, if they're more than just a first-degree burn, burns are actually pretty serious once they get to the point where they're covering a whole area of the body. So if someone has severe burns anywhere, even if it's just a small portion of their body, they need to go to the emergency room. If they have a deep first-degree or second-degree burn that's covering a section of the body, like most of one limb or a large section of the torso, even though that's not a severe third-degree burn, they still need to go to the hospital. Burns can be very serious very quickly. Anyone that is displaying bizarre behavior, if they are clearly confused or hallucinating, or they are delusional or violent or erratic. If you see the situation and there's no one there to take them out of the situation and get them into hospital care, then you would need to call 911 for this. If they are with a friend or family member, then they can take them to an appropriate hospital facility. Usually people do not have these situations, these symptoms come out of the blue. Usually it's with a known mental illness. But there are scenarios like strokes or something like that where this can just absolutely come out of the blue. And if that's the case, then that's an ER situation.